Welcome to M Health and Info, your ultimate source for all things health and wellness. Join us as we explore the latest in medical science, debunk health myths, and provide expert insights to empower you on your health and wellness journey. Hit subscribe, ring the bell, and let's explore the world of well-being together. This is M Health and Info, where knowledge meets vitality.
During pregnancy, it's important for expectant mothers to engage in regular physical activity to promote overall health and well-being. However, there are certain types of activities that should be avoided or modified to ensure the safety of both the mother and the baby. Here are some examples of physical activities that pregnant women should avoid. 1. Exercises lying flat on the back. After the first trimester, exercises that involve lying flat on the back for extended periods should be avoided. This position can compress the vena cava, a large vein that carries blood from the lower body to the heart, as well as other major blood vessels. When these vessels are compressed, it can reduce blood flow to the uterus and potentially cause dizziness, shortness of breath, or fainting in the mother. Additionally, reduced blood flow to the uterus means less oxygen and nutrients reach the developing baby, which can negatively impact fetal well-being. Therefore, pregnant women are advised to modify exercises that involve lying on the back by propping themselves up with pillows or using incline benches to maintain proper blood flow. 2. Hot yoga or hot Pilates. Exercising in hot and humid environments, such as hot yoga or hot Pilates classes, can lead to overheating and dehydration, which may pose risks to the developing baby. When the body temperature rises significantly, it can potentially affect the neural tube development of the fetus and increase the risk of certain birth defects, especially during the first trimester when organ development is critical. Additionally, dehydration can lead to complications such as low amniotic fluid levels, preterm labor, or even neural tube defects. Pregnant women are advised to opt for moderate temperature exercise environments and ensure adequate hydration before, during, and after exercise to prevent overheating and dehydration. 3. Activities with a high risk of abdominal trauma. Engaging in activities that involve sudden or forceful movements to the abdomen should be avoided during pregnancy. The uterus is a highly vascular organ, and trauma to the abdomen can lead to placental abruption, a serious condition where the placenta separates from the uterine wall prematurely. Placental abruption can cause heavy bleeding, abdominal pain, and compromise oxygen and nutrient delivery to the baby, potentially resulting in fetal distress or stillbirth. Therefore, pregnant women should refrain from participating in high-impact aerobics, kickboxing, or certain dance styles that involve jumping, twisting, or direct impact to the abdomen. 4. Extreme or intense activities. Pregnant women should exercise caution when engaging in activities that require excessive exertion or prolonged periods of strenuous exercise without adequate rest. While regular physical activity is beneficial during pregnancy, extreme or intense activities such as marathon running, intense cycling, or endurance training may pose risks to maternal and fetal health if pursued excessively. Overexertion can lead to dehydration, overheating, and fatigue, all of which can negatively impact pregnancy outcomes. Participating in prolonged and intense exercise sessions can elevate the maternal core body temperature, potentially reaching levels that are unsafe for the developing baby. Elevated maternal body temperature, especially during the first trimester, is associated with an increased risk of neural tube defects and other congenital abnormalities. Additionally, excessive exertion can divert blood flow away from the uterus and placenta to meet the demands of exercising muscles, potentially compromising oxygen and nutrient delivery to the fetus. Furthermore, intense physical activity can increase the production of stress hormones, such as cortisol, which may negatively affect maternal and fetal health. Chronic stress during pregnancy has been linked to adverse outcomes, including preterm birth, low birth weight, and altered neurodevelopment in the baby. Pregnant women are encouraged to prioritize activities that promote relaxation, stress reduction, and overall well-being, rather than pushing themselves to the limits of endurance or performance. It's essential for pregnant women to listen to their bodies and adjust their exercise intensity and duration accordingly. Paying attention to signs of fatigue, dizziness, or discomfort is crucial for preventing overexertion and ensuring a safe and healthy pregnancy. Consulting with a healthcare provider or prenatal fitness specialist can provide valuable guidance on appropriate exercise intensity and duration based on individual health status, fitness level, and pregnancy risk factors. 5. Activities with a high risk of falling. Participating in activities with an elevated risk of falling should be approached with caution during pregnancy to avoid potential injuries to both the mother and the developing baby. Falls can lead to direct trauma to the abdomen or other parts of the body, increasing the risk of placental abruption, fractures, or other complications. Therefore, pregnant women should avoid activities such as ice skating, rollerblading, rock climbing, or engaging in activities performed at heights. Ice skating and rollerblading involve rapid movements and changes in direction, increasing the likelihood of loss of balance and falls. Falling on hard surfaces such as ice or pavement can result in injuries such as sprains, fractures, or head trauma, which can be particularly dangerous during pregnancy. Similarly, rock climbing poses risks of falls from heights, as well as potential strain on the abdominal muscles and ligaments during ascent or descent. Engaging in activities performed at heights, such as zip lining, bungee jumping, or trampolining, also presents risks of falls and traumatic injuries. These activities involve significant impacts and sudden movements, which can increase the risk of abdominal trauma and placental injury. Even minor falls or accidents can have serious consequences for both maternal and fetal health, underscoring the importance of avoiding high-risk activities during pregnancy. Instead of activities with a high risk of falling, pregnant women are encouraged to choose safer alternatives that provide similar benefits without the risk of injury. Low-impact exercises such as walking, swimming, prenatal yoga, or stationary cycling offer excellent options for staying active during pregnancy while minimizing the risk of falls and trauma. These activities provide cardiovascular benefits, strengthen muscles, and improve flexibility without subjecting the mother and baby to unnecessary risks. Prioritizing safety and avoiding activities with known risks of falling is essential for promoting a healthy pregnancy and ensuring the well-being of both the mother and the baby. Pregnant women should listen to their bodies, use caution when participating in physical activities, and seek guidance from healthcare providers to create an exercise plan that is safe and appropriate for pregnancy. By choosing activities that minimize the risk of falls and trauma, pregnant women can maintain their physical fitness and well-being while reducing the likelihood of injuries during pregnancy. Collaboration with healthcare providers and adherence to safety guidelines ensure that expectant mothers can safely enjoy physical activity while supporting the healthy development of their babies.